Hello, I'm Dr. Aamir, your online health physician. Today we will discuss a disease called diarrhea. Before we start our session, it is requested to subscribe the channel and share with your loved ones and community for health awareness.
Dr. Aamir, what is diarrhea?
Diarrhea is a gastrointestinal condition characterized by frequent, loose, and watery bowel movements. It can be caused by infections, viruses, bacteria, food poisoning, medications, or underlying health issues. Dehydration is a common concern with diarrhea, so replenishing fluids and seeking medical attention if symptoms persist is crucial.
Dr. Aamir, how many types of diarrhea?
There are several types of diarrhea, including acute diarrhea, which means sudden onset and short duration. Persistent diarrhea lasting 2 to 14 days, and chronic diarrhea, lasting more than 14 days. It can also be classified based on the underlying cause, such as infectious, inflammatory, osmotic, and secretory diarrhea.
Dr. Aamir, which bacteria and virus causes diarrhea?
Various bacteria can cause diarrhea, including E. coli, Salmonella, Shigella, Campylobacter, and Clostridium difficile. Viruses that can lead to diarrhea include norovirus, rotavirus, adenovirus, and astrovirus. These pathogens can be transmitted through contaminated food, water, or contact with infected individuals.
Dr. Aamir, what is nocturnal diarrhea?
Nocturnal diarrhea, or diarrhea that occurs specifically at night, can be caused by various factors such as certain medications, hormonal changes, increased gastrointestinal motility during sleep. Medical conditions like irritable bowel syndrome or inflammatory bowel disease. Identifying the underlying cause is crucial for effective management.
Dr. Aamir, why diarrhea happens?
Diarrhea can be caused by various factors, including viral or bacterial infections, food poisoning, consumption of contaminated food or water, medication side effects, dietary intolerances. Underlying health conditions such as irritable bowel syndrome or inflammatory bowel disease could be the reason of diarrhea. It often results in an accelerated passage of stool through the intestines, leading to loose and watery bowel movements.
Dr. Aamir, what is food poisoning?
Food poisoning is a gastrointestinal illness caused by consuming contaminated or spoiled food. It occurs when harmful bacteria, viruses, parasites, or toxins present in the food multiply and release toxins in the body, leading to symptoms such as nausea, vomiting, diarrhea, abdominal pain, and fever.
Dr. Aamir, does stress cause diarrhea?
Yes, stress can trigger changes in the gut-brain axis, leading to alterations in gut motility and secretion. It may result in diarrhea or other gastrointestinal symptoms. Managing stress through relaxation techniques and lifestyle changes may help alleviate stress-induced diarrhea.
Dr. Aamir, what nutrients cause diarrhea?
Consuming excessive amounts of certain nutrients can cause diarrhea. For example, high intakes of magnesium, vitamin C, or certain artificial sweeteners like sorbitol and mannitol may have a laxative effect and lead to diarrhea. Additionally, lactose intolerance can cause diarrhea due to inadequate digestion of lactose, a milk sugar.
Dr. Aamir, what is traveling diarrhea?
Traveler's diarrhea is a common gastrointestinal condition that affects people traveling to areas with poor sanitation or contaminated water. It is caused by consuming food or water contaminated with bacteria, viruses, or parasites. Symptoms include watery diarrhea, abdominal cramps, nausea, and sometimes fever, and it usually resolves within a few days without specific treatment.
Dr. Aamir, how you diagnose diarrhea?
Diagnosing diarrhea involves a medical evaluation that includes a patient's medical history, symptoms, and physical examination. Diagnostic tests may include stool analysis to identify infections or parasites, blood tests to check for underlying conditions. Also imaging studies like colonoscopy or endoscopy to visualize the gastrointestinal tract and detect abnormalities.
Dr. Aamir, what is the differences between diarrhea and dysentery?
Diarrhea is a gastrointestinal condition characterized by frequent loose and watery bowel movements. Dysentery, on the other hand, is a more severe form of diarrhea that involves the presence of blood and mucus in the stool. Dysentery is often caused by bacterial or parasitic infections and can be more dangerous than regular diarrhea.
Dr. Aamir, what the sign and symptoms of diarrhea?
The signs and symptoms of diarrhea include frequent loose and watery bowel movements, abdominal cramps, bloating, urgency to have a bowel movement, nausea, vomiting, fever, and dehydration. In severe cases, there may be blood or mucus in the stool. Prompt medical attention is important if symptoms persist or worsen.
Dr. Aamir, what is the first aid for diarrhea?
The first aid for diarrhea includes hydration, drink plenty of fluids to prevent dehydration. Oral rehydration solutions, use commercially available solutions to replace lost electrolytes. Rest. Give the body time to recover and avoid strenuous activities. Avoid certain foods. Avoid spicy, greasy, and dairy products that may worsen symptoms. Seek medical attention if diarrhea is severe, persists, or is accompanied by other concerning symptoms.
Dr. Aamir, what are the precautions for diarrhea?
Precautions for diarrhea include maintaining good hand hygiene, drinking safe and clean water, avoiding raw or undercooked food, practicing proper food handling and storage, avoiding high-risk foods in certain regions, using bottled water for drinking and brushing teeth, and seeking medical attention if symptoms persist or worsen.
Thank you, Dr. Aamir. It was wonderful knowledge shared with everyone. Wish to see you with another health topic.
Goodbye and take care. Also share your comments and subscribe the channel for upcoming videos.